Mom, what happened to the baby? He has been crying without stopping for 3 hours already. What should I do?
Oh my, the baby is turning pale. Did he drink any milk?
No, he vomited immediately after drinking milk.
That's not good. Come on, pack your things. We need to go to the hospital.
I will call Tim.
No, we cannot wait for any longer. I will drive you to the hospital.
Oh, you are sick. Are you okay, Mom?
I'm still fine. The baby is more important. Hurry, please.
Yes, Mom. Thank you. Doctor, please help us. Something is wrong with the baby. He just cried like that for the whole night.
Okay, let me see. His heart rate is kind of slow. I'm afraid that the heart cannot pump enough oxygen-rich blood to the brain. Everyone, take this baby and head to the emergency room. Oh my gosh, is it dangerous? Don't worry, ma'am. Please fill out the registration form on the counter over there. The nurse will instruct you on the progress. Yes, doctor, thank you so much. Please help my grandson.
He will be okay, Mom. Sit down.
Hello, ma'am. Please follow me to complete the registration of patients. We need you to fill in the form.
Yes, sure. Mom, wait for me.
Alright, let me call Tim. I'm wondering where he is right now. Why didn't he show up?
Did you call my husband? What did he say?
I called him a couple of times, but he did not pick up the phone.
Oh, he must be very busy right now.
I suppose so. I hope nothing serious will happen to the baby.
Yes, this is the biggest hospital in the city. All the doctors have great experience in their work. We can count on them.
Was the baby still fine yesterday? When did you realize the difference?
Actually, I felt that the baby was not as active as usual. He did not sleep much, so I thought he was tired. But then this morning, he refused to drink any milk. When I forced him to drink some, he vomited on my dress. At first, he cried quietly, but later he cried more and more loudly. I have never seen him act like that before.
Did Tim come home yesterday?
No, he said he was dealing with an animals contract. So he went out very frequently. That's why I called you to come over to help me.
Did he help you to take care of the baby?
Yeah, but just sometimes. He just keeps the baby in the morning and at night. Normally, I am the one who changes his diaper, repairs his milk, and cleans up the house.
Why do you ask the babysitter to help you?
I did not want a stranger in my house. But I will consider that after this thing. I could not sleep at night because the baby just cried and cried. I'm exhausted.
Oh my, poor my girl. I totally understand. Taking care of an infant is not an easy job, especially when there is only you.
Yeah, thank you for understanding me, Mom. After all, only you really care about me.
Are you breastfeeding or using formula?
I was breastfeeding for first 4 months. Now I'm using a formula.
Does the baby get used to the formula?
Not very well, but I have no choice. I was not producing enough milk to feed him.
Excuse me, Mom. The baby is fine now. He just fell asleep. There's nothing serious. You can come visit him.
Oh, thank God that boy is okay. Thank you, doctor, so much.
Thank you, doctor. No problem. Please come to my office after 30 more minutes. I need to talk to you.
Both of us?
Only the baby mom is okay.
Sure, thanks.
See you later. Oh, look at my sleeping grandson. Luckily, you are safe. We love you.
What a relief, Mom. I could not imagine what I would do if anything bad happened to him.
Did you bring his stuff?
Yes, I brought some of his comfortable clothes, the diapers, hip milk, and some of his favorite toys.
Good. Okay, I will look after him. You can come to talk to the doctor.
Thanks, Mom. Oh, please call my husband again.
Sure, honey.
Hello, doctor. May I come in?
Yes, please. Are you feeling better?
Yes, I felt good. Thank you for helping my son.
That's the right thing we must do, ma'am. You know what? If you brought the baby here late for 5 minutes, something terrible could happen.
Really, doctor? Can I know what happened to my son?
We believe that your son has an ear infection.
What does that mean?
Children are more likely to have ear infection than adults. There is an infection in your son's middle ear that is making him uncomfortable. That's why he kept crying and having difficulty sleeping.
But why does my son suffer from that illness?
Well, there are many causes. It could be bacteria or viruses.
Is it dangerous, doctor?
Not really, but you need to watch out for him.
What should I do?
Did your son receive the recommended flu vaccine?
Not yet, doctor.
Okay, then go ahead and do it. Besides that, remember to clean your hands often before you touch the baby. And your baby needs to be breastfed for at least 12 months.
Oh, that was hard for me a little bit.
And you need to avoid the baby exposure to smoke. You also need to dry his ears thoroughly after taking a bath.
Yes, I do remember all of that. Did he need any medicine?
I suggest watching and waiting to see if your child needs antibiotics. This gives the immune system time to fight off the infection. If the baby doesn't feel better after 2 or 3 days of rest, I may write a prescription for an antibiotic.
Thank you so much.
Okay, that's all. You may come back with your son. Oh, I did not see the baby's father. Where is he?
He's busy at work. My mom's had helped me instead.
Okay, at least there's somebody that you can ask for help.
Yes, I'm blessed to have her and my son beside me. They are my life. I could not live without one of them.
Yeah, family is the most important thing. So, good luck. And I'll see you around.
Thanks. See you later.